Hello, I am Marwan Abourass. Over the years, I developed the 4R operational diagnosis protocol, a structured system designed to refine and standardize diagnostic behaviors in everyday dental practice, specifically general practice. And every one of the master classes in the protocol has something, a proven concept, a method that elevates how we think, how we observe, and how we decide as clinicians. Now, in the heart of the first masterclass, first step, patient report and report, lies one of my favorite innovations, the structured initial oral exam. Now, this is not your comprehensive examination you learned in the dental school. This is something new. I designed the initial oral exam to be the first moment of connection, an act of care that goes beyond the patient chief complaint, the patient purpose of the visit. No. From the very beginning, I make it clear to the patient that I know I will take care of your problem, but let me take a look. We are not just treating a tooth, we are understanding a person, and that is the patient. The initial oral exam is the entry point into my protocol, the 4ROD, a place where you can reclaim diagnosis as a discipline. When you watch the exam in practice, in the presentation, you might look like casual, almost, I am simply glancing around, it's disorganized. But no, in my mind, in my mind, I have a structure, a mental checklist. I have the 5 clinical disciplines in my mind. I'm screening for clinical indices, signs, warning signs. I'm looking at endodontics, periodontics, prosthodontics, orthodontics, and oral pathology. These are the components of oral health care. And just in a few minutes, less 3 to 5 minutes, in that short visit, I identify urgent condition that requires immediate attention. I classify the patient needs. Is it limited, emergency, routine, or comprehensive? I decide which radiographs to take. I decide which additional comprehensive tests I need. It's exactly like a OPG. It provides a broad overview, and then you focus. In my mind, it gives me a functional map, a roadmap that guides every decision that follows. This simple 5-minute practice gives a meaning that trusts the whole encounter. It's not about adding gadgets or extra steps. It's about we are adding clarity and compassion to our first encounter with the patient. We are really behaving as doctors who cares for patients. We're not focusing on microscopes and gadgets and all of that. The initial oral exam is a thinking tool grounded in structure, the 5 disciplines, logic, and relevance to what you see. It's simple enough to perform, as I mentioned, 3 to 5 minutes. And again, in your own mind, okay, you have the 5 disciplines you're looking for. It will guide you from there on. In addition to that, it shows the patient that you really care about prevention. And it's true. It's a preventive exam. You'll find things you never thought about or the patient knew about. All of the information in the initial oral exam is used into the one-on-one session. And that is so essential because immediately after the initial exam, you're going to have the one-on-one session, you're giving feedback. The initial oral exam is more than a clinical procedure. It's a philosophy of care. Philosophy of care that shifts from the reactionary dentistry, respond to the patient problem, into proactive diagnostics, prevention. And it worked. It worked for years. It helped me be a better diagnostician. Thank you for listening.